Brody. How are you doing today? That's good. My name's Kathleen and I'm going to be your nurse. We're going to be inserting a Foley catheter per your doctor's orders just to help assess your urinary output. Okay, and I'm just going to raise you up. And could I get your first and last name, please? And your date of birth? Okay, great. And do you have any allergies to latex, iodine, betadine, anything like that? Okay, no, that's good. Alright, so I would wear the clean gloves. First I would wash my hands, then I would put on the clean gloves to provide perineal care. So I would just lift this back and provide as much privacy as I could to the patient. Okay, and then after providing perineal care, I would take off my clean gloves. And then I would wash my hands again and proceed with the Foley catheter. Okay, so I'm just going to make this into the first valve. Put that right there. Out on the sides and back. I would grab the tip of the drape with the shiny side going down. Okay, and now I would put on my little gloves. Okay, once I have my sterile gloves on, I'm going to pick up my sterile field and move it over here. Okay, so first I'm going to take my saline solution and plug it up to the catheter, the port on the catheter. Okay, now I'm going to take the betadine, open it, and pour it over the cotton swabs. And I'm going, once my non-dominant hand touches the penis, it will not move. So I'm going to take the cotton swabs, go from the head in a circular motion to my hand. And I will repeat with all of the cotton swabs, only using them once. And if there happened to be a break in the sterile field, I would start the procedure over. Okay, once I've done that, I'm going to take the lube and I'm going to insert it into the tip of the penis. This may be a little cold, but it'll be okay. Alright? Okay, once I have inserted the lube into the tip of the penis, I'm going to insert the catheter until it reaches the Y. And once the catheter reaches the Y, I will inflate the balloon, unhook the syringe, pull back until we meet resistance, and then once resistance is met, I can hook the catheter to the leg, bring the catheter down, making sure it does not go above the level of the bladder. Okay. And now to obtain, if I wanted to obtain a sterile specimen right when we put the catheter in, I could get it from the bag, but if it's a little later, I would need to clamp the catheter, put the syringe in the port, and take a sterile specimen like that and put it in the sterile specimen container. Alright, so I'm just going to get this over the Okay, and so now I would take off my sterile gloves. I would wash my hands, put clean gloves on, then I would provide perineal care to get the iodine, excess iodine off of the penis. Take this off. Okay, now I would cover the patient back up, making sure that he's in a low position and side rails up ×2. Then I would document how the patient reacted to the procedure, the size of the catheter, what kind of catheter, the amount of output right when we inserted it, the color of the urine. And then I would get my stuff and exit the room and throw it away. Mr. Brady, how are you doing today? My name is Catherine and I'm back to take out your Foley catheter per your doctor's orders. And while I'm doing this, could I just get your first and last name for me? Okay, and your date of birth. Alright, great. So now I'm going to lift your bed up to a working height. I would empty the catheter bag before we got started. And straighten the sheets back and provide as much privacy as possible. And then I would unsecure it from the leg. I would place the syringe into the port and deflate the balloon. Once the balloon is deflated, I would gently remove the catheter. Then once the catheter is removed, I would provide perineal care if I needed to. I would cover him back up, let him back down, make sure there isn't any discomfort or anything, that he's okay. And then I would document how he reacted to removing the catheter and